The second topic that we'll be focusing on in today's lecture is the treatment planning process in CBT. One of the major assignments that you'll be working on in this class is to plan treatment for your hypothetical client and submit it. So this lecture will help you develop a basic understanding of the process. So let's begin. Treatment planning is a process where you're creating a blueprint for your entire work with your client, creating this overarching framework of your work. So it's helpful to review some of the main things that you will be working on in different phases of therapy. So in the beginning phase, you will start building a strong therapeutic alliance with your client, which will become foundation for your future work. And then you will educate clients about their diagnosis, and then orient clients to CBT and socialize to do homework, collaborate to set agenda and provide feedback. So kind of setting up that expectation for regular structure. And then you will identify and specify goals for therapy and engage your clients in some problem solving. And in the beginning of therapy, your cognitive specific interventions would target mostly those superficial level of automatic thoughts. So you will teach clients to identify, evaluate, and modify negative automatic thoughts. And then while you're doing that, particularly for clients with very limited coping strategies, you want to start building coping skills for your clients. When you get to the middle part of the therapy, hopefully you built some therapeutic alliance and your clients is used to the regular structure of CBT, and they understand what you're doing. They know the rationale for cognitive intervention. And then they develop some level of comfort with you so that you can start addressing some beliefs. In the middle phase, while you're continuing to work toward therapy goals, you will emphasize identifying, evaluating, modifying clients' beliefs, which includes both intermediate beliefs and core beliefs. And you will teach skills and techniques that your clients can use to modify unhelpful beliefs. As you get to the final phases of therapy, you will prepare your clients for termination and preventing relapse, and then provide clients many opportunities to take the lead so that they can own the skills that they learned in class, and then use those skills outside the session so that they can become their own therapists and maintain the progress that they made with you. To do effective treatment planning, you want to consider client's diagnosis and then their presenting symptoms that are current and that most disturbing for your clients. You also want to actively utilize the cognitive conceptualization throughout the entire phases. And then the plans and activities, assignments that you're going to be working on would all be informed by the cognitive conceptualization diagram that you create in the beginning of therapy. You want to incorporate SMART goals, which we'll talk more about later. And you want to focus on the most pressing concerns. Again, your clients may bring in so many different issues, but your goal is not to fix the whole person. Your goal is to just help your clients feel better, and then just experience improvement in the area of your client's most pressing concerns. And effective treatment planning also considers phases of therapy. When you decide to utilize some kind of skills and techniques, you want to consider whether those techniques and skills are appropriate, considering the phases of therapy. So you want to make sure that the skills that you're using to identify core beliefs. I mean, that's not the kind of techniques that you would actually teach in the beginning of therapy, because in the beginning, you would rarely actually touch beliefs, but you will address mostly clients' behaviors and clients' like emotions and automatic thoughts. And then you want to consider individual characteristics, your client's learning style, and life stage, developmental, intellectual level, gender, and culture. All these complex history and background that influence your work with your client. Also, you want to consider the level of motivation. Some clients might be really ready to work on with you and make progress, and then some clients you just may need do more of the probing to get them really engaged in the process. And therapeutic alliance, I don't really have to say more about this. I've been saying how important therapeutic alliance again and again. So as I mentioned before, goal setting is really the major part of your treatment planning. And it's important. Your goals have to be specific by stating exactly what you want to accomplish. So you can include information, who's going to be doing what, where and why, all those information. And your goals needs to be measurable. Think about how you would know that your client achieved the goal. So how will you demonstrate and evaluate the extent to which the goal has been met? What would be the indicator? So think about that. And your goals should be achievable. It has to be realistic. It's something that, considering your client's current level of functioning, something that realistically attainable. Your goals also has to be relevant to the key things that you want to accomplish, and also relevant to your client's functioning and their clinical symptoms. And then that should be informed by the cognitive conceptualization diagram that you create in the beginning of therapy. And your goals should be time bound or time limited. Again, one of the major principles of CBT is that CBT is time limited. So you want to set specific timeline when you want to see the specific goals achieved. You can engage your clients in goal setting from the very first session. And there are multiple steps that you can go through to set goals. And then first of all, the most important step is to provide a rationale. Why do you want to set goals? You want to explain your reason, and you want to help your clients understand the value of going through the steps to set goals. And the most important thing that you would do in this first step is to instill a sense of hope, because your clients who are depressed might really not see the point of coming to therapy, especially if they have been to many different agencies. If they've seen like a lot of different therapists in the past, they might not really have hope that anything would be different with you. And also have a clear picture of where the client wants to get at the end of therapy. So again, goal setting, the goals should not really come from you. It should really come from your client. And the second step in setting goal is to understand your client's daily schedule. I mentioned that this could actually be done as part of your evaluation session. to get an idea of a typical day of your clients, because your clients might not necessarily volunteer to provide all the information that you need. So it is very possible that you may actually miss some important piece of information. And kind of looking at your client's daily schedule is one way to really have a comprehensive look of what's happening in your client's day-to-day lives. The next step is to have your clients identify their core values. So what's important to your clients? Family, relationships, their work, health, spirituality, hobbies, finances, whatever that really gives a sense of purpose and meaning to your clients, because those are the things that are really foundational. In the next step, you want to start asking some broad goals that your clients have for a treatment. By asking these questions, such as, what do you want to get out of therapy? What are your goals for treatment? How would you like to be different as a result of treatment? How would you like your life to be different? So kind of get an idea of what your client is hoping hoping to get out of therapy. And then you want to get more specific. Let's say that if your client says, I would like to get happier, you can ask, if you're happier, what would your life look like? What are some of the specific areas that you want to see some change? In collectively, changes in those specific areas will actually help you feel happier. In setting goals, you always want to collaborate with your client, and also your clients might be bringing multiple issues at the same time, but you want to work with your clients to prioritize those issues, really starting from the issues that's most pressing for your clients. You may encounter some challenges in goal setting, such as when your clients have difficulty expressing their goals. Then you want to use Socratic questioning to guide your client to better articulate what they want to get out of therapy. Some example Socratic questions that you can ask is, would you describe a time in your life was better than now? What does your typical day look like then? Are there things that you were doing then that you're not doing now? If you're feeling better, what would you like to be doing differently? How do you want your life to look like a year from now? Or if you're just meeting your clients like short term, 3 months from now or 6 months from now. So by asking these guided questions, you can help your clients to better articulate their goals. Another kind of difficulties that you might encounter is your clients getting really hopeless, or have other negative reactions. And then you want to assess clients' negative automatic thoughts and explain how having these kind of negative automatic thoughts directly create impact on your client's functioning, and how you're going to be working on with them to address those negative thoughts. So some of the example negative thoughts that your clients might have: I'll never feel better, this is just my life, therapy won't help, my life will always be the same. So it will be important for you to identify those negative automatic thoughts that are related to goal setting, and address that early on. And also, you may have clients who constantly want to set goals for other people. You watched the video where one client was like constantly trying to shift the focus away from himself, but talk about what his father needs to do differently. In that case, you want to help your clients to rephrase so that the goals are not about other people but about themselves. So if your clients say that I want my children to listen to me, you can kind of model rephrasing the goal. That's a good goal, but could we rephrase it to something we know you have control over? For example, what do you think of this goal? Like to learn more effective ways of dealing with the kids. Rephrasing could be one way to kind of shift a focus away from other people, and then help your clients be more active in setting goals for themselves. I provided a brief overview of the treatment planning process in CBT. Just know that your treatment planning in your agency might look different, and then your agency might have like specific forms that you need to use for treatment planning. But treatment plan that you'll be submitting for this class as an assignment is specifically built to assess your knowledge and skills, specifically relevant to CBT process. So just know that it's gonna look a bit different from the usual treatment planning that you'll be doing in your agency. So I will spend some time in the Zoom live session to walk through the treatment plan process, and I will use the template that you will use to submit your assignment to show you an example of how you would create a treatment plan for the purpose of the assignment. So that was it for this week. I hope you have a great week, and I'll see you next week. Bye.